Over the past 4 years, the response to community identification of HIV/AIDS and access to drugs and the management has been effective, especially at community levels. This is according to the Director General, National Agency for the Control of AIDS.
Over the last 4 years, and especially during the period of COVID-19 pandemic, Nigeria has demonstrated tremendous capacity for HIV case identification at community level. Nigeria's HIV response was the most COVID-19 resilient globally.
In Nigeria, efforts to manage the epidemic of HIV/AIDS has been commendable, with over 1.6 million receiving treatment out of 1.9 million people living with the virus. This year, the agency is educating the people at the grassroots on how to avoid sexually transmitted diseases.
Over 1.6 million Nigerians are accessing antiretroviral therapy, which is incredible for a country, for any country, but it should just be known that most of us expected it would happen here in Nigeria. I have been so impressed and inspired by the national program's ability to double the numbers of people accessing HIV treatment by taking services to the community during COVID, which a number of countries did not do, but Nigeria did.
Health experts from different fields also call for an end to stigmatization of those living with HIV/AIDS, saying it is not a death sentence.
It is important to note achieving AIDS-free society is possible if we can join hands to demand for HIV services, support persons infected with HIV to access services, and end all forms of stigma and discrimination against persons living with HIV and AIDS.
We adopt a digital platform called iMonitor. The iMonitor had a wide range of indicators that monitor a quite number of HIV services that enable people at the grassroots level to provide feedback and to also demand services and to also link people to where they get these services.
No woman should give birth to a child who has HIV. It is our commitment to the global community. It is our commitment to the people of Nigeria.
More awareness is therefore required, especially amongst youths, on sexually transmitted diseases, STIs, stigmatization against patients, enlightenment of the rights of those living with HIV, and most importantly, self-protection against sexually transmitted diseases. Oli J. Wapera, Arise News.